Healthcare topics you need and wellness tips you deserve, all straight from the doctors themselves. Maayong Adlaw, Cebu. I'm Priya Padilla-Roleta from CDN Digital, together with the hospital at Maayo, and this is Maayong Adlaw Doc. In the past two episodes, we talked about basic skincare and the importance of not skipping your sunscreen to keep that skin healthy looking all the time. This week, we have another interesting topic, a therapy that can help you achieve a more youthful look. But before we head over to our talk, let's watch this video about the hospital at Maayo Aesthetic Institute.
The hospital at Maayo Aesthetics Institute prides itself on providing the most advanced surgical, non-surgical, and cosmetic procedures for all ages and all skin types. Their internationally trained surgeons and staff are committed to help you achieve your desired aesthetic appearance from head to toe. The hospital at Maayo Aesthetics Institute is looking forward to addressing your medical, surgical, and cosmetic needs at the premise of their private and luxe setting. Their Aesthetics Institute also offers lasers and other anti-aging procedures like botulinum toxin injection, skin tightening, and more to reverse any signs of aging. The hospital at Maayo Aesthetics Institute procedures are performed by their internationally trained and board-certified dermatologists.
So if you're planning to get treatments for your face and body, head over to the hospital at Maayo today and consult with their board-certified dermatologists to evaluate your skin. For today's episode, we will be talking about a procedure offered here at the Maayo Hospital that is beneficial for our skin, and it's called Botulinum Toxin Injection for anti-aging, treatment and prevention of fine lines, wrinkles, and excessive sweating. Now, Robbie, you're describing me again. Now, let's learn more about this procedure from our guest doctor today. He graduated as a Doctor of Medicine from the Cebu Doctors University and completed his residency training in dermatology at the Southern Philippines Medical Center and underwent his subspecialty training in dermapathology and immunofluorescence at the McKay Memorial Hospital in Taipei, Taiwan in 2017. He is a diplomate of Philippine Dermatological Society and a member of the International Society of Dermatology. He is an internationally board-certified dermapathologist given by the Asian Academy of Dermatology and Venerology. He is now currently a part-time faculty at the Cebu Doctors University Hospital, the section head of dermatology at the hospital at Maayo Aesthetic Institute, and an active consultant at Vicente Soto Memorial Medical Center. Let us welcome our guest for this episode, Dr. Armand Merton. Hello, Doc! Kumusta?
Hello, ma'am. Good morning, and hello, everybody.
Hey, we have a very interesting topic. I find it very interesting because, first of all, I don't really know much about it. Okay, so I think you have to educate, enlighten us, especially women my age. No, enlighten us about this because we have some not very nice concepts about this. We are talking about botulinum
Toxin.
Botulinum toxin injection. It's a procedure. What exactly is botulinum toxin?
Yes, so the botulinum toxin, it's a procedure. It's an injectable procedure. So we usually use this for fine lines and wrinkles. Literally an anti-aging treatment.
I'm conscious now because he's mentioning the things that I have on my face. Continue, Doc.
Yes, so anyway, like I said, it's for anti-aging. So we usually use this for mga fine lines, wrinkles, especially the crow's feet or the wrinkles we have when we smile, when we frown.
I have a question just to clarify for the rest of the people a bit ignorant like me with regards to basic skincare, how much more advanced skincare. Botulinum toxin
Yes.
injection, is it the thing that we know as Botox also? Is it the same?
Yes. Actually, botulinum toxin is actually the toxin for the medication. Botox, that's a common brand name, but sometimes we use those terms interchangeably. So when you hear the term Botox, we're literally talking about botulinum toxin injection.
Okay. So so Botox is one of the first brands.
That's correct.
Of this medicine. So it's like Colgate, huh? Like even if
That's
you
right,
bring
Colgate,
something else,
a brand of
okay,
toothpaste,
what's your
but yes.
with Colgate when you're actually bringing something
Exactly.
else.
Yes.
Okay, so Botox or botulinum toxin. Okay, so
You know what? Let's just
is
call it Botox.
Okay, it's
for the
safe.
sake of
It's not actually promoting good the brand if we say Botox.
Not necessarily.
Right? Okay, so
because
let's
it's
call
used
it Botox.
interchangeably. Yeah.
Okay, so Doc, as I mentioned earlier, I'm very interested about this because I visited my derma, and every time I do, she keeps on telling me to get Botox, and I have this negative parang connotation with Botox because I don't really understand it.
Right.
So how does it work?
Yeah, so that's the common
Is
thing
it
about
safe?
Botox.
Ano?
Yeah, that's a very good question. And I get this question all the time actually. Is it considered safe? And sometimes we portray it as it might be natural or whatnot. First of all, how it works, right?
Okay, good.
So when we inject it in the muscles, we inject it to paralyze or to reduce the strain of frowning or smiling with our eyes. And this smiling or frowning, it produces wrinkles over here. So when we inject the botulinum toxin, it relaxes those muscles so that you won't have those fine lines or wrinkles. So for example, let's use us as an example.
I laugh a lot, so I produce a
Yes.
lot of this.
Actually, I noticed.
Uh-huh.
Sorry, like over your forehead and your crow's feet.
Yes.
So I know why your dermatologist suggested it. Because you will notice here, the crow's
Yes,
feet over
yes.
here, or even the forehead
Mhm.
wrinkles.
Yes.
So like I said, we'll inject the toxin
Yes.
here. It will relax this so that when you smile, it still has the the smooth effect over here and the smooth.
But the name contains the word toxin. So can you explain that? Isn't that scary? Because we were asking earlier, is this safe? But the name itself has the word toxin.
Right. The reason why we call it toxin, originally it was a poison. Okay, so this poison was discovered in tainted sausages, and it actually causes death or spastic paralysis. Now we turned it into a medical treatment. We used it first to treat relaxed muscles and to treat cross-eyedness or strabismus. And later, they discovered that when they treat the cross-eyedness, it also relaxed the muscles of the face and the wrinkles disappeared. So generally, it was a toxin or a poison, but we accidentally discovered it. It has aesthetic purposes.
Oh, serendipity.
Yes.
Okay. So, Doc, so it's safe. So we've established
considered
that
safe.
it's safe.
We purify the toxin, and of course, it's safe for the body.
Okay, but question is, how often do you get this? How often should you get this?
Right. So the toxin, it doesn't last permanently. At most, it's every 6 to 9 months before the effect completely wears off. Okay. But when I say completely, even if you do it like just one session or at most 2 sessions, there were still gradual effects. It will still affect or still improve your appearance, even if you do not maintain the medication.
You mentioned that it prevents wrinkling because it doesn't make your crow's feet like.
That's correct.
But the question is, how come this Botox is actually portrayed in shows or in films? Because if somebody gets Botox, they cannot smile, they cannot laugh. It's so negative. Where is that coming from? And is that happening really
Right. So that's a very common question, and that's one reason why people do not jump all over the procedure right away.
Correct.
Right? And it's very funny in the movies. They do portray it like they have a frozen face, or
Yes.
they cannot move. But the truth is, they're just exaggerating. In the real medical procedure, we do it very subtly, or of course, we want to make it look as natural as possible. Now, like I mentioned earlier, the way it works is we literally reduce the movement of the muscles. Now, we could do it ever so subtly, or we could also overdo it as what is portrayed.
Okay.
But usually, it's not that case.
So going back to the effectivity of this how long will it last? Okay, when are we supposed to get it, and how long does it last? You mentioned it's not permanent, but more or less how long before it wanes out and you need to get another one?
Right. So, like I mentioned earlier, every 6 to 9 months.
Okay.
Now,
He mentioned, I did not listen.
right. And the other
Listen,
question
Mama.
is when should we start getting it, right?
Oh,
Or
yes,
when is
correct.
the better time to get it? Now, we usually use it for fine lines and wrinkles. Now, you could get it as early as mid-20s or when you start 30s and above, because that's when we really start to develop these wrinkles,
Isn't
right?
mid-20 still very young?
Actually, the FDA approval for this toxin is 18 years old and above already.
Wow.
Yes, and there's this thing right now, or the trend that, an ounce of prevention, right? Better than cure. So why do we have to wait until we have wrinkles before to get injected? So a lot of my patients, they're getting younger actually. So it's better to prevent these wrinkles than to treat them while they're already there.
Yeah, you mentioned earlier that even if it wanes off, it still makes you look better in
Right.
time, right? So,
That's correct.
so it's not true also what we've heard that once you stop, you're gonna sag again.
No. You just go back to your original.
Mhm.
And that's another common misconception that, oh, if I don't maintain it or if I stop it, it'll look worse than previously, which is not the case.
I see. Are there any cases wherein the patient becomes like really addicted to it? And what happens when one patient keeps on asking for it over and over?
Right, so we do get patients, they're actually happy with the results, right?
Uh-huh.
And they do maintain it actually every 6 to 9 months up until the effect wears off. Now, in terms of addiction, probably not the physiological or the need kind of addiction,
Yes.
but they do enjoy the effect. So they tend to
psychologically,
maintain,
right?
yes, but they tend to maintain it after just because they're happy with the results.
Is it expensive to maintain?
Well,
Can we? Yes, just for the sake of everybody.
of course,
Is it possible if
that's a
we-
very common question also. Cost
More
is a
or less
big
how much?
thing. We have to be cost effective here.
Uh-huh.
Depends what you consider expensive.
Uh-huh.
Diba?
right.
What's
Depends on
expensive
your
for me may not be
priorities,
expensive for you, right?
correct.
But usually we pay per unit of the toxin because it's dose dependent. So if we just inject a little, if we just want to enhance a certain feature with a small amount, of course it's cheaper.
I want to start with a small amount. How much will I pay?
Okay, I'll give a ballpark figure
Yeah,
just
please.
because. Okay, so the average face uses like 30 units, right, of botulinum toxin. Usually, if you get Botox anywhere, you pay per unit man. So let's say mga 350, 400 pesos per unit. So expect to pay maybe on the range of 7 to 10K for your first at a lower dose. Yes.
That's a lower dose
PHP,
already.
sorry.
The 10,000.
Yes.
Okay. So the following session, would you be getting a lower or a higher dose? How does it usually go?
So it depends on the patient also. So we may inject more or we may leave it as is. It depends on the needs of the patient. Usually if grabe ang wrinkles, as in, it's very strong frown muscles, of course we have to inject more.
So that's practically like 10,000 pesos for almost a year.
Yes, that's correct.
Right?
6 to 9 months.
Ah.
Yes.
I've heard some Botox at a very cheaper price. Can you explain why the big difference? You're mentioning 10,000. How come the others could give it at a way smaller amount? Is
Right.
there a difference with the kind of medicine that they use? Is it safe what they're giving to us because it's at a cheaper price?
Yeah, so that's a good question also, no? Because there are so many injectors out there, right? We do have a lot of aesthetic clinics out there. Even in the malls, you get a botulinum toxin injection, right? Actually, first, the price I mentioned, that's just a ballpark figure. It may be lower, it may be more expensive than that, depending on the brand you use also, okay? But if you're telling me cheaper than that, I would have a hard time trusting it because you have to remember, the toxin, this is medication itself. Not all brands are FDA approved. So diba, when we have medications, it has to be FDA approved. So we know it's safe, we know it's effective. And sometimes when you go out, you don't know what they're injecting.
Because you see, there's this thing as generic brands, right? So
Right.
is there such a thing also with this one? If it's the same generic, of course they have the same components, so they
Yes.
should more or less have the same price. The only difference is the branding of the other one. What can you say about that?
Me personally, I always use branded,
Mhm.
especially when it comes to the botulinum toxin.
What's the difference between the branded and the generic ones?
Right, so
when it comes to
generic,
that?
literally, it's just the generic na toxin, diba? But sometimes it's not really regulated. Sometimes you're not sure if it's, like I said, FDA approved. It has to be the formulation which they claim it is, right? And sometimes we can't be sure of that. So I only use trusted brands or established ones.
So what we're trying to say is that others that are probably generic or not that expensive might be diluted with something else.
That's
Okay. Now, isn't this also what they call a lunch break procedure? Can you explain? I heard something that they
Is
call
that what they call
Botox.
it? Sorry,
Oh,
I
a
don't call
lunch
it
break
that.
procedure. But you've heard. Have you?
I haven't heard that term,
No,
but
I-
I will just assume
I
that.
read somewhere and
Okay.
I heard someone call it as a lunch break procedure.
Probably because it's very easy to do. It's simple. You could do it in your free time.
Mm-hmm.
Okay, so when we do the injection, literally just stand there. Maybe 10-15 minutes, you're done. Put a little ice, inject here and there, and that's it.
Really?
Break time over.
What you mentioned stand, so you're doing this while standing?
Oh, I'm sorry, sitting upright. Sitting upright. Yeah.
Okay, so that's 10 to 15 minutes. Is there any
Around there.
Oh, okay. Is there any downtime on this procedure?
Oh yes. So of course, after injection, there's some aftercare. Like for example, you're not allowed to do strenuous activity for at least 1 day after the injection.
Why?
Then you're supposed to stay upright for at least 4 hours. And yeah, why? That's a good question. When we inject it, it's in the muscles. So if you do a lot of strenuous activity, if you're sweating or if you lie down, sometimes the toxin will migrate to other parts of your face.
Okay.
And you could have the side effects commonly seen with botulinum toxin.
What are these side effects?
Yeah, so you could have sometimes like lid lag, sometimes you have the Spock eyebrows where the eyebrows are overly raised.
What's the first one? Lid lag? Is
Lid
that-
lag.
Oh,
So it looks like you're sleepy.
okay.
Yes.
Those are the most common side effects.
Those are
Physically,
possible
that
side
you can-
effects,
Oo.
yes.
How about with the way you feel inside? Like you feel, I don't know,
Oh,
really,
headaches.
like feverish.
You may have
headaches.
headaches
Okay.
associated with the
Would
procedure.
you recommend this for someone who has migraines?
Actually, it can help.
It
Those
can-
with headaches or migraines. It depends where you inject it also. So
But
there are a
you
lot of...
mentioned that the side effect is headache. So for people who get easily migraines,
Sorry, let me clarify that.
yes, please.
When we're using botulinum toxin for the aesthetic side, we're injecting here in the face, right?
Mm,
So that procedure in itself may cause headaches as part of the side effect.
okay.
Now, if you do migraines or other headaches, we inject the botulinum toxin somewhere else. So it's usually over here in the occipital area. So we also use it as a treatment for headaches.
Ooh, I
So
think
it
I
really
need
depends.
that.
It really depends.
Okay. How long does it last for migraines also? That you'd be getting rid of the headaches for more or less how long also?
It's hard to say because these are more or less what we call off-label uses. It's not studied well enough, or
Okay.
sometimes the data is insufficient to say how long it lasts.
But it has been working for
It
you
has been
guys. You have
working.
noticed also.
That's right.
Okay, that's why you're doing it. All right. Now, going back to like when you get the procedure, lunch break procedure.
Yeah.
Going back to that, what are the other do's and don'ts? You mentioned you don't do strenuous activities for a day. You have to stay upright for at least 4 hours, okay? Other things that we need to remember in case some of you are interested to get this now.
Actually, those are the two basic things you have
Just
to do.
that?
No? Just that.
Wow.
But another thing you have to do, like after the procedure, we have to observe for at least 2 weeks for the maximal effect. So you still have to come for follow-up so we could see if you might need more or to do any adjustments if possible.
So it's like a magic medicine. Like when you inject it, all of a sudden these beautiful wrinkles of mine will disappear. Is it like that?
That's the best part about Botox
Uh-huh.
or botulinum toxin because the effects more or less, they're visible. They're more or less immediate also. Unlike a lot of procedures, to treat these fine lines and wrinkles, not many procedures have that kind of drastic effect. So botulinum toxin.
And you can
Pretty good.
still put anything, the usual basic skincare that you do.
Oh,
You
yes.
can just no
Of course,
contraindications or anything.
there would be no interactions
Oh,
with your
that's really
topicals.
nice. I don't know if I'm gonna get it yet, but I think
You might want to consider it. I'm not saying you need it.
no,
But
my
we
derma
could
keeps on
enhance.
saying,
Yeah.
go get it, it's safe. But
Yes.
we haven't really talked about how safe it is, what exactly it is, because every time I visit her, I ask about something else, okay? And I'm not
Right.
really just that interested because again of the probably negative also portrayal of these
Right.
of this procedure through media ba?
Right.
So
But you have to remember, it's $1 billion industry, right?
yes.
A lot of people do it, and
Yes.
it's relatively safe.
I have this one day. I really wanted to ask this. Botox has been around for quite some time.
1980s.
Correct. I remember that. And that was when I first saw movies with people doing like that in their faces.
Yes.
Botox now. But how come it's like, the word is not really resurfacing, but how come the interest in it? Why are we reviving the interest in it this time when it has been around for so long already?
Well, it's always been popular. Maybe there's just lack of, I don't know, actually skilled injectors, or it's not as advertised as well. Because like you mentioned, it may not have a good reputation in a lot of areas, but those that understand the procedure or that have actually talked to their doctor about it, they're pretty interested in it actually.
Okay, so last message to those people who have been actually considering getting Botox but have been very, apprehensive, skeptical. Would you want to say something to them?
Well, I wouldn't want this to sound like an advertisement, no, but yes, it's safe, it's effective, you get to see the results. The results are drastic compared to a lot of procedures, and I think a lot of patients would be happy.
I don't
after
think
their
it's
procedure.
advertising, Doc. I think it's informing them, educating them, right? That it's really safe. Because there's power in knowledge. If we keep on thinking that this is bad, this is wrong, this is the reputation that they get, and we just keep on accepting it, without really educating ourselves, we come out as ignorance. So I think this is really good, especially for a woman my age who doesn't know anything yet about Botox. I find this very interesting, very informative.
Yeah, and people will be more comfortable, especially if they understand how it works and they know that, it's actually safe, it actually works. So,
Exactly.
That's why I appreciate the questions you asked also, because these are the common questions that I get actually.
And again, we don't have to be scared. We just have to ask our doctors, right? No need to be scared about anything. Just ask, because when we know, we understand better. Then we can decide whether we want it or not, right?
That's right.
Thank you very much, Doc. This has been a very informative,
This was fun.
episode.
I hope we learned something today.
Oh, I'm sure, because I did.
Great.
Thank you, Doc. And to everybody, I hope you also learned something. Thank you for joining us today, Dr. Arman.
Thank you, ma'am. Thank you, everybody.
Thank you very much for joining us today. Please share this episode to your family and friends so they may also learn from our topics. Now, from their promise of Maayo, which in Cebuano means be well, discover a new healthcare experience in Cebu at the hospital at Maayo. This has been Priya Padilla-Rodeda, and we hope you learned from this episode today. To know more about the hospital at Maayo, head over to their Facebook page at the hospital at Maayo or their website at www.thehospitalatmaayo.com or call these numbers below. See you again next time.